Premature ejaculation is one of the most common sexual problems in men, but despite this fact, men usually do not want to talk about it. It is known that the cases of men who suffer from early ejaculation are about 1 in 3, however it should be noted that in most of these cases, premature ejaculation occurs sporadically and not permanently, which makes it easily treatable. Premature ejaculation happens when a man ejaculates much earlier than desired. It is ejaculation that happens prematurely and without control, and usually occurs with only a small amount of sexual stimulation. That makes it impossible to continue coitus to satisfy the couple and a man himself. There are two types of premature ejaculation: the primary, that happens when it has been present throughout the sexual life of man, and the secondary, which can appear along with erectile dysfunction, and which can be easily treated. Premature ejaculation can present various symptoms. It is important to know them and seek the help of a doctor if you suffer from any of the following symptoms. Ejaculations that happen in less than a minute after the penetration. Inability to delay ejaculation during sex. Inability to control the ejaculation of seminal fluid. The causes of premature ejaculation are different, but we will specify the 5 most common. Bad sexual education. Lack of sexual education can have an effect on ejaculation, especially when the man is in his teen years and looks for ways to satisfy himself abruptly. Anxiety. The periods of anxiety caused by personal or work problems in men can cause inability to control a sex life and begin to impact life of a couple. Stress. Prolonged stress can affect not only various aspects of your life, but also your sex life. Unsatisfactory sexual life. When sexual expectations are not reached, this can trigger a problem that can lead to premature ejaculation. Poor blood circulation. It is known that the erection occurs when the blood enters the penis. In case of poor blood circulation, it is likely that this will cause ejaculation to occur prematurely, leading to ejaculation problems. Although premature ejaculation is treatable in most cases with simple and sporadic treatments, in other cases it requires more specific treatments. Some complications are also likely to occur, which must be taken into account. The prolonged and continuous lack of control of ejaculation can lead to frequent sexual dissatisfaction either of the sufferer or of his partner. Premature ejaculation, which occurs before the penis enters the vagina, can prevent a pregnancy, which can lead to complications in the couple, especially if the pregnancy is desired. There is a variety of treatments that can help you control premature ejaculation and minimize your symptoms. However, it is important that you first assess the symptoms and find out if they are similar to those of premature ejaculation. Consult a doctor who specializes in the subject to help you, and, above all, offer you the appropriate treatment according to the intensity and frequency of your ejaculation problems.
BENZOCAINE condoms. These benzocaine condoms are created from the same material as the other condoms on the market and even look the same. However, in addition to carrying the lubricant that facilitates penetration, it incorporates an anesthetic substance inside. As always, the use of these condoms has its advantages and disadvantages. For example, the use of condoms is not advisable if any partner is allergic to latex. Stop and start technique. This is a known technique that has the aim of increasing control of ejaculation and is based on making several masturbation attempts that are performed before penetration. The idea is that the subject masturbates without his partner intervening in any way, and in this way try to get as close as possible to an orgasm. Before coming, he must stop the masturbation movements, relax and start the same process again. This results in ability to predict a moment of ejaculation, and avoid it in order to prolong intercourse. Lidocaine spray. For a long time, a lidocaine cream has been used for premature ejaculation treatment. It was specifically designed to decrease sensitivity of the penis and counteract premature ejaculation. One of its main advantages is that the absorption of the spray is much faster. It starts working in only 5 minutes, so you don't have to wait long for it to help. KEGEL exercises. KEGEL exercises are used, for example, in cases of urinary incontinence, because they consist of trying to learn to control the muscles known as pelvic floor muscles, which are responsible for ejaculation control. Logically, at first it is impossible to control these muscles consciously. However, when practicing several times, the contraction and relaxation can be done consciously to avoid the reflex that causes ejaculation. Natural medications. Not all treatments for premature ejaculation have to do with sprays, medications, ointments, and exercises. There are also many options that resort to natural treatments, especially nowadays when everything natural is very trendy. The two best natural options are ginkgo biloba and valerian flowers and roots. Taking this type of natural medications helps the penis to relax and thus, the blood circulation increases, which allows it to maintain erection longer. Valerian flowers are used for several things, making it one of the most common natural remedies to counteract stress and anxiety, and since these conditions are closely related to premature ejaculation, ingesting them before intercourse can help control the cravings and nerves, making sure that premature ejaculation does not occur.
The truth is that there are many ways to control and even reduce premature ejaculation. It all depends on leading a healthier sex life, taking better care of stress and anxiety, and in case it is recurrent, proceeding immediately to a specialist that will consult you and suggest a treatment if necessary. Whether you decide to try KEGEL exercises, natural medications, spray, or any other method, you can be sure that you can learn how to control premature ejaculation and lead a full and satisfying sex life.